You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices with Vicki McManus-Peterson and Dr. Chad Johnson.
I am so excited to be here today. Dr. Johnson could not join me, but I am sitting here with Dr. Colin Lathrop here at the Productive Dentist Academy. We're at the Productivity Workshop, and he is from Katy, Texas, a rock star already. It's been so much fun visiting with him the last day and a half. And I wanted you guys to hear what I'm hearing from him because he thinks differently. And I love people who think differently. So Colin started his practice 5 years ago. He's through the stratosphere already. He's doubling and tripling, year over year. He's just doing great. So Colin, welcome.
Thank you. Thank you for having me.
Came from Katy, Texas to Fort Worth. That was not a big drive.
I took a plane. It was a quick flight, 50 minutes.
Awesome. That's awesome. So one of the things that you and I were talking about that I just love, I love cross-trained teams. But talking to you, you kind of took the concept of cross-trained teams on steroids. So tell people about your team and how you have your practice organized.
I have 4 full-time hygienists. I have a part-time hygienist who helps. She's the 5th one and helps with overflow. I have the rest of my team, 5 assistants. So that's it. It's all clinical team. They're all cross-trained. I set that up from the beginning when I started my practice. My 2 main long-term original employees, Miranda and Shelby, I had worked with them. They were assistants in a previous practice that I worked at, and then they left that practice for various reasons. And then I ended up opening my scratch start afterwards. So I called them, they came in. Now, my history, I started working in my stepdad's dental practice when I was 14.
Wow.
So I typed in insurance claims on a typewriter. I ended up networking the office, we had Easy Dental for DOS.
Oh, wow.
Was the next upgrade. And then Windows 95 came out. So I'm aging myself a little bit. We did a peer-to-peer network, and we upgraded to the Windows version of Easy Dental when they did that conversion.
Right.
So everything else was the original old school way of doing things. And so I had to learn all of that stuff. And when I opened my practice, I had already known how to call insurance companies and get insurance breakdown for verified benefits,
Right.
have all that information beforehand. We set up our electronic claims with Dentrix or with Open Dental when we opened. But my history with Dentrix and Easy Dental, I knew how to do all those things, how to coordinate all that and what steps. And so I knew the day-to-day of running a dental practice.
That's like a superpower for dentists.
Yes.
That's such a lot of doctors will get an MBA and then come into dentistry, and that's great because they have the long-term strategic thinking.
Right.
But you've got that day-to-day management kind of COO operational side, that's a killer superpower.
And when we started that way, I knew exactly what they were doing.
Right.
And I was able to teach them to a very high level.
Yes.
And then all of the other things that we've implemented and added over the years, we still add things and they learn things and I learn things as well. So that foundational learning has worked wonders.
So who sits at the front desk?
So Miranda mainly sits at the front desk.
Okay.
Because she's the best on the phone. She's the sweetest person in the world. When you walk in the door, she's always got a smile. She'll stand up, come over, shake your hand, introduce herself. But when she answers the phone, it's so natural. It's like she's been talking to, an old family member or a long lost friend or any of those things. So that's one of her strengths. And so I put her there where she ended up being, such a strict position for her.
Right.
She's very organized.
Right.
So she keeps books of all the receipts and everything for purchases and all those things by year and organizes all that stuff.
Nice.
But she is my fixed ortho assistant. So we have a braces patient for short-term ortho, or if I have a patient that I'm going to be doing fillings on and they are in active ortho, I've coordinated with a local orthodontist where I don't have to send them over to the orthodontist office,
Right.
and they have to take all that stuff off,
Right.
and then the patient comes over and we do a filling, and then they go back to the orthodontist office because the moms go crazy with shuttling these
back
kids
and
back
forth.
and forth for something so simple. And the orthodontists appreciate it because it frees up their schedule.
Sure.
So they're really happy that we're able to do that. And we put everything back just the way that they had it. So Miranda will do that with me or for me. When I come in, I do the filling. She'll assist me for the filling. She'll finish up putting them all back together and then send them back over. And she'll go back up to the front desk. She's the one who I'll put on QuickBooks to do refund checks. So she'll have a whole list that when the insurance company payments come in, she'll apply it to the account. If they have a credit on their account, it goes straight on the refund list.
Nice.
And so about once a month or every 2 or 3 weeks, then she'll come and find me when she gets time to do that. So I said, okay, so I'll log into QuickBooks real quick. She'll enter in all the checks and then it'll just be sitting there. By the time I get around to printing them and signing them later on, that's already done. And she can help me keep that ticked off of my list.
Right.
But yeah, she's the best on the phone. Shelby will be at the front sometimes as well, or she'll go out to other offices and train them on different things. But she'll come back and assist me for implants or crowns, or she'll scan patients for Invisalign, take all the photos for Invisalign.
Nice.
Any of my hygienists will scan for Invisalign with iTero Element. If the phone rings and Miranda's already on the phone, Shelby's on the other line, rings again, Kelsey hears it because her hygiene room is closest to the front desk. She will step up, she'll grab the phone, and she'll walk around until she finds someone to hand it off to, or she'll answer the question, schedule the patient, or whatever else it needs to be, and then she'll go back and finish up her hygiene appointment.
Nice.
Doesn't happen all the time, but when the phone's ringing and you've got people already on there, yes, you have services that can pick up after so many rings with voice IP or call tracking or Golden Goose scheduling, any of these companies that do these things. But nobody can really answer questions about my office better than my team.
Right.
So we just have these redundant systems.
I was going to say, I love the redundancy of your systems. It's like systems on systems on systems. Who is in charge of collections and AR and those things?
So Miranda will look at the AR list periodically, and then she will call because, again, she's great on the phone. She's just so sweet on the phone. So she's nice when she's calling, asking for money. Shelby will go into Square, which is a credit card reader program. And so she will go in and actually email the outstanding account balances to individual patients. And it has the little message in there that, insurance company has already paid everything. The rest of the balance is for yours, and we appreciate you paying, and that sort of stuff. So they'll look at the AR pretty much weekly, if not every few days. And they stay on top of that really well. We're a very low percentage. Our total outstanding AR is heavily weighted on 0 to 30.
Right.
So we collect roughly around $215 a month on average. And so our AR, I think right now is like 107, and the 90 days is like 12,000 or something like that. So even from a normal monthly collection amount and production amount, we're still usually under 50% of that. Usually we're about 40%.
That's awesome. And
They-
you're over
so
90s.
they
It's like
collect well,
0.01.
Yeah. They collect well. They collect always before we drill. That makes the most sense.
Yep.
You shouldn't be working on people for free.
Right.
So yeah, it just works really well.
I love that. You also brought up the point of using Square, which blows my mind that more dental offices haven't adapted technology like this. Even in my practices, it was really difficult to get the team and the accountants and everybody. They're like, oh no, we have a merchant credit card processor at the front. And like my first CPA that I didn't stay with very long, but he put in all the systems, because again, my practices were thousands of miles away from me, right?
Sure.
So I said, okay, bank, CPAs, put in the systems. What I want is for everybody to be able to check a patient out in the operatory. So, we ended up telling them I want an iPad checking out in the operatory. Guess what I got?
Terminal.
I got a terminal. Guess what kind of terminal I got?
Plug in.
A plug-in that printed out the receipt that they had to sign. And I said, I'm 2,000 miles away. How do I keep up with all of this? And they go, oh, get this. They're going to Scotch tape those pieces of paper onto computer paper once a day and then scan them up to the cloud. And I'm like, oh my God, give me a crayon.
Wow, talk about efficiency.
Yeah, and this was 2011.
Yeah.
So it was, and I was like, just give me a pair of pinking shears and a marker, would you? Like this? No, get that out of there. So I never achieved what you've achieved, which is amazing.
So I looked at that as far as using an iPad for paperwork. That was the thing. So I used Yappy with Open Dental, and I thought, okay, well, you got to be able to take a credit card on an iPad. So that's when those square card readers first started coming out. Is right when I opened.
Yeah.
And I looked at it, and yes, originally the processing percentage was a little bit higher.
True.
Because of the convenience and everything else. But I would get an email as soon as the transactions go through, and it was all linked to my email. So I'm sitting at my computer, and it would pop up, Square payment, $1,000 or whatever it is. And I look at the schedule and go, oh, okay, cool. But they paid, they're seeing the patient now. So I can keep track and make sure that all the payments are coming in. You get a daily.
That's kind of like a just for fun thing.
Yeah. It was, and I didn't even know that it was on there. It just kind of popped up. I was like, wow, I get emails for these things. But the convenience factor and the speed of it, because you have a patient who comes in with a broken tooth. They come in, they meet someone at the front, they walk them all the way back, they take an X-ray. We take extraoral photography only. We don't use intraoral cameras. And so they'll take pictures of the teeth, of the problem. They'll take X-rays, 3D if needed, whatever the situation is. And they can show the patients what the issue is. So it's very, very transparent.
Right.
And then, I'll come in, do an exam. Yes, you broke your tooth. We need to do a crown for you. It's really simple. We can get everything set up for you or scheduled or whenever's convenient for you, we'll take care of you. So I walk out and they go, well, the next question that usually happens from the patient, one of my team members is, well, can we do that like today, like right now?
Yeah.
And they're like, sure. And your portion is X number of dollars, and I'll go ahead and take your payment.
I love that. So I just want to pause here because you are so systems based and so efficiency minded, and I love it because 2/3 of the questions we get are challenges, right, between the front and the back of the team and all that. You've just flattened everything out, and by using technology, right. So I want to go a little bit deeper. You've got Square, Yappy, Open Dental, which by the way I love Open Dental.
Fantastic. Only way to go.
And you've got a 100% clinically trained team. That's a 100% admin trained team. So if the front and back is having a conflict,
there's no conflict.
They need therapy because they're arguing with themselves.
They're all in the same team the whole time.
They're all in the same team. I love that because how convenient that is for the patient.
Well, the other thing is, I was listening, overhearing input from another office who's here, and it sounds like there's in this one office, there's one person who does just about everything. And that's scary.
What a
in my
bottleneck.
mind.
What a risk.
It is about, what if she has the flu?
Right. That's high risk.
What if she moves? Or in other situations, you have embezzlement from people who have too much control over all of the systems, and then the rest of the
checks
office.
And balances.
That's right. And the rest of the office is susceptible to those things. So, if Miranda's sick and she's out, well, Shelby takes over, then Nicole cycles in. I'm starting to train my other assistants up into some of those duties as well. What if they just don't want to work
Do you
anymore?
all take vacation at the same time, or do they rotate out on that too?
They'll rotate days off, vacation. If I'm out, of course, a lot of times those with kids will take vacation the same weeks that I'm off because I'm out on vacation because of the school schedule.
Right.
So that works pretty well. But I don't care when they take vacation, as long as it's on the yearly calendar in the kitchen in the back and everybody knows about it, and that we have coverage the whole time to make sure that the office can stay running if I'm there or if not. That's
pretty awesome.
Yeah, because I wanted to make sure also that I was not able to be held hostage by an employee.
Right.
By oh, well, nobody knows how the insurance comes in and gets into the system, and what do we do? And oh, Susie's not here today. Where is she? I don't know. And everything comes to a crashing halt. The rent's still
I sure hope that dentistry continues to evolve where this becomes the norm. Right? Because I was an assistant who became a hygienist who didn't forget that I was an assistant. And the biggest compliment I would get is like, man, for a hygienist, you're a pretty good assistant. And I was like,
and my hygienist, they assist me with Invisalign deliveries, scans, T&D appliance scans. So we send out, via the cloud to the labs. They'll also assist me with fillings, same day fillings, and size ledge chipped on the front tooth or a filling popped out or any of that sort of stuff. They just grab the filling set up and they open it up and they start helping me with it. They know it's quick and we can work together.
So you're in Texas. What kind of expanded functions do you have in Texas?
We don't.
And so you're at like 2.5 million now?
I'll be 2.5 million this year.
This year.
That's kind of where we're plateauing, which was the reason why we came to PDA.
Yeah.
Because I wanted to figure out how to get everybody on board so that we're still moving and growing and developing our skill set so we can provide the best for our patients and for ourselves. Because I want to take home more income. That's the goal. I didn't get into this to go broke or any of that.
No. I would be really curious. I haven't asked you this yet. So what nuggets, because you're not a practice that's looking for, we talked about this earlier, like some are building the haystack, right? And others are looking for the needle in the haystack. You're a needle in the haystack kind of guy, because one small tweak for you is massive leverage.
Right.
So have there been any little small tweaks or things that you picked up on that you think people are excited about? Or
I think the two biggest takeaways that will help us immensely in the next quarter or the next year would be getting more control over our schedule with block scheduling.
Yes.
And making sure that we're analyzing our billing as far as maximizing what we're doing, the amount of time, and billing correctly for what we're doing, getting paid for what we're doing.
Right.
Because there's a lot of things that I will sit and I spend a lot of time with patients and families and moms talking about their kids and all kinds of things. And there's a lot of things that I'm actually doing on a day-to-day basis that we're not even charging for.
Right.
And I have a very young demographic, very healthy.
I was going to ask you about this because you think differently because you were raised differently through the dental chain. Even most dentists who are dentists didn't start out building the computer system, right? You didn't start out typing up the insurance claims. They started out doing something in the lab or something a little more technical on the clinical side. So I love that you started out on the administrative side. But you are totally opposite of 2/3 of all the dentists I work with.
But I've also worked in every practice model that you can work in.
But you love kids. Oh my gosh. So talk to us how you've built this robust super dentist, full mouth rehab. You market to train wrecks, but you're very kid friendly. How do you do that?
I'm surrounded by kids, didn't have a choice. And we're just always really good with them. I have young kids of my own. I have 3 girls and a boy, age 7, 5, 4, and 10 months.
Wow.
My oldest is autistic. And so that helps keep me grounded and centered.
Absolutely.
All the kids that were coming into the practice early on when we first opened, we had to do something with them, but they were all healthy.
Right.
And I wanted them to enjoy their visit. That was the big deciding factor. I tried to figure out when we opened, I tried to make a list of all the things that people did not like about dentistry. And I tried to include kids in that. What is the kid's perception of what's going on? They're always scared and they're hiding and all these other things. So when they come in, the one thing that most people do to ruin an appointment for a child is they'll start off by shoving an X-ray sensor or film in the kid's mouth. Usually doesn't fit, and they start squirming and crying, and then at that point in time, the appointment is really going downhill.
Yeah.
So again, we went back to the technology. So we use extra oral bite wings with our Vodtech stand-up pan cone beam machine that we have. And we will shoot that because kids also, in my demographic, they're very healthy. You can look at them around. I don't have rampant caries and OR hospital case type kids, that sort of stuff. So the thing that the biggest benefit that I can provide for them and their families is tracking the growth and development.
Right.
So the extra oral bite wing will give you all of the teeth.
I'm gonna put an asterisk on this because we put in it wasn't Vodtech, but that was high on my list too. We went with the Plan Mecca system, and it was specifically for the extra oral bite wing.
Right.
And I've talked to a lot of other people, and they go, yeah, I got it, and then I gave up on it. The team, blah blah blah. I'm telling you, it is worth the workflow. It is worth the learning curve to get your team through it. Kick, scream, cry, replace, whatever. It is worth it. And yes, it's different, but I've coached a lot of offices, and the first thing I do is I look at their X-rays, and I will guarantee you that 9 out of 10 sets of bite wings, they're cone cut.
You can't see
it's a disaster. It's blurry. It's overlap. They're cone cut. The quality is for crap, but we bill it out and we say we looked at it. Yep. And so, you know what? If it's a little You miss a little bit in the beginning as you're on your diagnostic learning curve. That's okay. You're missing a lot the way they are
That's right.
today.
But you can see missing teeth, you can see growth and development, you can see orthodontic eruption patterns
Yes.
that you never will see on two little bite wings on a little kid.
Right.
You're not going to see that cuspid is turned over, probably headed towards an impacted issue.
You see the sinuses.
So you see all of this stuff. Now, you're a prudent provider. So you look at those x-rays, you look in the mouth as a clinical exam, and if you see caries somewhere that you really need a detailed PA, then go ahead and take that.
Sure, but now the kid trusts you.
That's right. That's
Right.
right. And you're doing that at the end of the appointment. After they've sat there with the lights off, there's no overhead lights on the office when the patients are in there.
Ah,
So they're very I have a lot of sensory and special needs and autism spectrum kids in my practice as well, because the school district around me,
they know.
they have a highly integrated function or program in the schools. And so we have a lot of these kids that come in, and when we turn the lights off and give them headphones and they're watching TV, I call that digital sedation.
Ah,
So we took them for a ride in the space machine. They got their x-ray. They did great. Everybody's standing there looking at them while they're doing it, and they're smiling. Their brothers and sisters can see them. And so they enjoy that portion of it. So then they go back in the room, they get everything cleaned up, and I come in, do an exam, that sort of stuff. And they've enjoyed their visit.
I want to be a kid just so I can come to your practice.
Because if you make it a lot more fun, my eighth op, which I can't take away, I can't add a dental chair and delivery system and everything else in there because it's a kid's room.
Ah,
So I do a lot of my kid pedo 2-year-old exams in there because I have a headlight on my loops. I'll walk in, the assistant or a hygienist will come in with a tray behind me with a mirror, maybe some gauze if we need it. And I'll do an exam and I'll look. We call it a happy visit. If they're not going to have a prophy that day because they're just freaked out or that sort, as long as I can see and look, I'm looking for arrangement. I can look at the teeth. I can talk to the parents about large tonsils or some dietary issues or any of that sort of stuff. Then you kind of baby step them into building their confidence.
yeah,
Because then once you do that, and you may have to have them come back a time or two,
yeah.
but once you get them and you've had a good experience from the beginning, they don't become this lifetime dental phobic patient or any of that sort of stuff, as long as you don't ruin it along the line.
Right.
But many times these kids, when you force them, hold them down, all these other
that's
things,
so bad.
just for the sake of,
I bet you don't have a papoose in your office.
absolutely not. I'm not going to torture somebody's kid,
Yeah.
because a mom's sitting there watching that. You think she's going to want to come in and have her dentistry done or refer her neighbors? Yeah, they were great. They manhandled my child while the child was screaming bloody murder. You should go there. That's not a big referral source.
No, and you were telling me that. I mean, you really have that traditional family pride. First come the kids, then comes the
You get
mom.
mom in, you get dad 2 years later. You get the grandparents once they move to town to live next to the grandkids. You get all these neighbors. That's the biggest benefit of it. So it starts early.
Right.
And you have different problems dentally during the different decades of your life.
Right.
So I look at those different issues as those kids are growing up or as other family members are coming in, and you can see correlations between the parents, dentition, and the kids.
Oh,
You say,
that's
you
cool.
see how your teeth are really narrow and you're a mouth breather and that sort of stuff. I'm worried that if we don't do something to interrupt that pattern, that your child here is going to follow the same steps. So why don't you have them see an ENT, look at these tonsils, look at their airway, all this other stuff. It's in the best interest of that child. It's also good for the parents. It's good information for them to make a good, well-informed decision about their children.
Right.
And if we're expressing that level of concern for their child and for them, which is the right thing, that's what we should be doing anyway, that also is going to bring way up the trust level in us.
Oh,
and
yeah.
it brings way down the barriers to treatment acceptance for the rest of the family or anyone else.
So do you have sleep apnea as a component of your practice?
I do. The portion that I do is a procedure called night laze with a light walker.
Oh, yeah. Yeah.
Fotona's light walker laser. So I will
I
do that.
love Fotona's night. We put
I
a
have two of them.
Fotona, yeah.
So I bought one. My associate and I, at the time.
You bought the big one and the little one.
Yeah, so I bought two big ones, same
Okay.
ones. So we were fighting over the laser. And so we were using it so much for these no-shot laser fillings and all this other stuff, all the soft tissue work and with all of our implant surgeries, that it started to become a bottleneck just having one.
Right.
And I'm also a big fan of redundancy. Yes, it's expensive,
Right.
but I needed another write-off and I needed some other equipment to add in there so that we could continue doing more and more procedures. And
Right.
we were able to generate enough income to pay for those easily. So it was 5 months later, I bought a second one. And so we used them routinely, alternating between myself and associate. And now I'll have hygienists trained to use that for some of our soft tissue perio protocols and implement that for better health. But
we're typically on everyday practices. We just talk about, what makes your life work, what makes your practice work, and you give us like 10,000 pearls on that. So I'm gonna let you nerd out here just a little bit, because the Photona laser is so new and different. Can you nerd out on this sleep apnea procedure with the light walker, because it is the coolest.
So what happens when we age is all that collagen starts to unroll.
Right.
So the soft palate starts to drop down, just like you're dropping a curtain down.
Yes.
And so you can use the laser to activate that tissue, changes the biochemistry. It will shrink, the tissue will raise up, which opens the airway. Now, I many times will use it also with a snore guard or something like that. Now, I also refer the patients, I tell them to go get a sleep study.
Yep.
I want to make sure that if they have undiagnosed apnea, that at least that they have a chance to fix it the best way possible.
Right.
Most of the cases that I do, they just can't tolerate the CPAP.
Right.
And I try not to say, oh, you shouldn't wear that. Or I'll say, well, get the CPAP, see how that's going. Let me do night lays for you. Maybe your CPAP will work even better, or you can turn the pressures down. Or that may be the differential between a full face CPAP and then a nasal only.
Right.
And the nasal, they have higher compliance. So maybe they can't have enough pressure going through the nasal without night lays. So if I do that as a combination therapy, and I've talked with the sleep centers, I've talked to the sleep docs around, I'm talking to the ENTs now. That's my next kind of project, is talk so that they know what's available.
Yeah.
Because there's no real good overlap of information from all the different specialties.
Right.
And so that therapy has been fantastic. But the
How
biggest
frequently are you doing this? Are you bought 2 lasers, but you use them for a lot of different things.
I use
How
them
much?
for all sorts of stuff.
Yeah.
I do a lot of implant surgery, so I'll use them to uncover implants. I'll use them to biostimulation to speed up healing in an extraction socket around an implant. I will use them in my cosmetic cases, my full arch or full mouth reconstruction cases,
Yes.
as far as tissue management, either the removal of tissue or troughing around crown margins instead of packing cord. I still pack cord in a lot of cases. I still do a lot of the old school stuff, but I also do all the new school stuff as well. And I can blend all of those techniques and technologies
That's cool.
for the best of the case itself or the best for the patient.
I don't think I have it in my bag, but I just bought a handheld laser at the Serona, Dentsply Serona World. They had those there, and I've got 2 of them. One's a blue light laser and they're for TMD, migraines, dermatology, things like that. So I got the blue one for precancerous cells. We spent a lot of time in Hawaii. So I mean, definitely my husband's on a Marlin boat like 120 days every winter.
Right.
So I'm like, I am going to laser your head. I'm going to get these precancerous cells. And then the other one is for that collagen production and helping with the TMD and headaches and things like that. I'm loving it because it's better than Botox.
That's
So it's pretty darn cool.
I use TechScan.
I love T-Scan.
I do DTR. I learned that from Ben Sutter and Robert Kirstein, best ones in the world to learn T-Scan from. We have an iTero element for our Invisalign cases.
Yep. I
was using that for the digital scans for all my digital FMR workflow that I do. I also have a Trios now that I just got. So I will scan a patient and I can get to an FMR in 3 days.
Wow.
Because I can scan, my dental designer can design it pretty much overnight or the second day. I can print them on a 3D printer in my lab. I have a Moonray, and then I can make a silicone transfer. I can get them into that very quickly so that the patient doesn't lose interest, spend their money on vacation, or if you get a wax up from a lab, it takes weeks and weeks and weeks.
And I've got to emphasize again, this is so amazing. You went from scratch start 5 years later, $210,000 a month, and all of this knowledge and technology and team so well trained.
And we kept it simple. That's the thing. Yes. That's the big deciding factor on implementation.
Let's end on that then. Tell me how, for anybody who's sitting here listening and they're like, I don't have a T-scan, I don't have a laser, I'm like maxed and all that. What's your decision point around bringing in something new like that? Because I see there's this shiny object syndrome, right? And you go to a show, you buy a new thing because it's going to suddenly be the magic bullet to save your practice.
And most dentists sit in the back room, plays
Yeah. So how do you avoid that? How do you really evaluate what's being tossed at you? What's worth investing in? What's not? What's your decision process on that?
You have to make a commitment to use it every day. So if you can't tell yourself that you're going to use that every day, then you shouldn't buy it. You're wasting your money. You're wasting time. You're ticking off your team members because they'd rather have that money instead of you burning it on a piece of equipment.
Right. So if the sales pitch is, if you only do 3 cases a month, it'll pay for itself in a year.
Yeah, but you have to look at it realistically and see,
Right.
is this something I can really do?
Right.
And that's the best way of adding any of those things. And you can't add all of those at once. If you did a startup and had all the technology that I had and you try to have all that from day one, it's not going to happen. You're not going to
So
get
just
enough money
start
from a lender.
simple, bread
Start
and
simple.
butter.
That's right.
Are you electric hand piece?
Electric hand pieces in all my rooms.
Do you cut dry like Bruce does?
I polish dry.
Okay.
So I will cut wet, pack cord if I'm using cord, and then I will switch, turn my speed down on the same burr, and then I will dry polish that way until the teeth look almost wet.
Yeah.
And that way I get good temps coming on and off. I have great margins as far as my impressions or now digital scanning. So, but it works well. I have not prepped teeth completely dry yet. So I was talking to Bruce about that. And
Might be the next little challenge.
I may
Experiment.
see about that on a case or two got coming up.
Yeah, he's
So-
done it for 20 years. I've
Yeah.
never seen anything come back to bite him yet.
Yeah, but you got to pick things that are going to work well for your
Exactly.
patient mix, your procedure mix,
Yep.
Your comfort level, your technology level.
Yeah.
And I grew up with computers and all those things. I wasn't really a techie or that sort of stuff. I just liked computers. That was it.
And I think that's the beauty of like you're obviously a very productive dentist, right? And there are a dozen ways to get to that end goal of being productive and
That's right.
efficient. It's all about what is predictable in my hands, what am I going to commit to, and I love that you said, what am I going to do every day?
Yeah,
Yeah.
I did every day. So if I'm stuck at work every day that I work, I'm away from my kids, I want to have cool stuff to work with and play with,
Yeah.
while I'm working. And I looked at these things as far as, well, okay, it takes forever to do a lower molar filling because you got to get them numb.
Right,
Well, what if I could do that same filling in like 6 minutes,
right,
5 minutes, start to finish? And this isn't deep. I mean, you're doing an indirect pulp cap
right.
and an interproximal, an MO or MOB or something like that. Well, the laser will cut out all that waiting time for anesthetic, and I give the patients a choice. I say, I can do it with my laser. It feels really cold. If it's too cold, I can always get you numb, and you'll be numb for a while and that sort of stuff. But if you want me to give it a shot without all the anesthetic, then I can do it that way if you're okay. And they're like, yeah.
I love
And then
it.
they have it done. Then they go post on their own Facebook timeline, not on our office page, but
Right.
on their timeline, and tag us. And I say, yeah, I just had these no-shot laser fillings over here. Nobody else around here has one of these lasers, because I tell them what to say and how to market it for us. And that works because then it brings in a lot of these other indirect referrals for other things.
Yes,
And that's where all of those things help pay for that technology and reinforce what we're doing. And then helping us also to be good ambassadors for dentistry in our community.
I love that.
Because then you're bringing down a lot of these barriers as far as fear and all those things.
Getting more people to come.
Yeah, you can keep them healthier.
I
You can
love
make a
that.
bigger difference. The kids love it. It makes them interested in different things. The parents are sitting there on the edge of their seat while we're doing laser fillings on these kids they don't even care what we're doing. The kids aren't even numb. They got headphones on watching TV, wrapped up in a blanket because we keep it kind of cold in there. Because I'm usually running around. So integrating all of those things for the best dental experience that we can provide and providing a better service, frankly, as well.
Right,
Laser fillings, they don't just pop out.
right.
Sometimes the way that some people prep some of their fillings, clinchers, brushers, they'll pop that bond seal, that MO or that occlusal filling will just pop out. It will just debond.
Right.
Well, I don't want fillings coming out. I don't have a lot of that anyway. And then once I started using the laser, I never had it again because it just super etches everything. And you get such a better adaptation of material into that preparation. So the restoration's better, it lasts longer. You're not going to be redoing stuff. You're not working on the same teeth over and over.
I love
I don't think that's a good model. Some dentists like that, but it's just
No,
not me. So, and it just works way better because that's what the patients want.
yeah,
And
just
so if
do
you're
it
giving
right
people
the
what they
first
want,
time.
they're going to want more of it, or they're going to tell more people about it.
I love it.
If you're walking around with a syringe and you're stabbing people, that, and you do it to where it hurts, and then you're drilling on them forever, they don't like any of that stuff. So stop
Yeah.
doing those things.
Well, Colin, it has been a pleasure having you here today. Chad and I always have one question that we ask every guest. You got to choose one.
Okay.
Ham or eggs?
Eggs.
There you go, folks. Thank you so much, Dr. Lathrop from Katy, Texas.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with everyday practices.